What is the Alexian Orthopedic Institute?
Well, it's really something that we've defined recently. It's not to say that now we have orthopedics. I mean, Alexian Brothers has always had, not always, but for quite some time certainly had a very solid orthopedic program. But recently we've developed new programs, educational opportunities, partnerships like we have, as Gene just mentioned, with the Park Partnership, and really a focus on medical innovations, being a research type institute as well. So it really we're trying to wrap together a bunch of different components that we may have had in segments, maybe didn't have a whole lot of focus on, but we're now trying to package them so that the community better understands what Alexian Brothers has at an orthopedic program.
Okay. And what makes it different from other orthopedic programs in the Northwest area?
Certainly not to diminish any other programs. There are several very solid orthopedic programs here, but I think one of the things that really distinguishes our program, and I have absolute confidence in saying this, is really our surgeons, surgeons like Dr. Luke, and we have individuals who are involved in really pioneering minimally invasive surgery, and everyone talks about minimally invasive surgery. It's kind of a nebulous term, but we have surgeons who teach on minimally invasive surgery. Individuals come from Canada. Dr. Keith Schroeder, one of your partners, does a minimally invasive teaching for the knee. Other surgeons doing minimally invasive spine techniques. So we really are leading the charge in many areas of making a patient's recovery much quicker, less painful. Dr. Luke does a procedure where you need not do a second incision when you do spine surgery. Sometimes you have to do a second incision in the hip to get material to use in the spine. Don't have to do that anymore with this new procedure.
Wow.
So it's really, really impressive. I think we distinguish ourselves also with the programs we have put together. Education, outreach, helping keep people out of the hospital if at all possible, quite honestly.
Now, do you get a lot of athletes or people that are into fitness activities like running or swimming or that kind of thing as patients?
I think we do, and Dr. Luke could speak to this better than I can, but you know, activity is a great thing, certainly, to keep your bones healthy, but sometimes just wear and tear, even without massive injury, you can just wear down your joints. So we do see athletes, and we see athletes from Iowa. Quite honestly, we've had people come down who just can't get the care that they want in another state sometimes. So we've got quite a pull here.
If you do, Dr. Luke, if I may ask you this question, if someone does wear down their knee joints from 30 years of running, is it possible to do something that might be able to put them back on the road?
Well, again, as Keith was stating, there are many new technologies that are becoming more or less invasive than prior. My associate, Dr. Schroeder, the founding member of our group, is one of the pioneers in the northwest suburbs, and actually all of Illinois, with respect to minimally invasive knee surgery. And the younger the patient is, the less invasive you want to get.
Sure.
Now, if you have an arthritic knee, majority of the time, if you're over the age of 50 or 60, you're going to put in an artificial knee replacement, a total knee replacement if they failed the non-operative modalities. There are new treatments that are less invasive, a unidepartmental knee arthroplasty, where you actually don't replace the whole knee joint, just the part that's involved. And you can do that in a very young patient, and it's minimally invasive. It's really almost outpatient surgery. And my associate, Keith Schroeder, is probably one of the pioneers in this area.
Oh, that's great. That's excellent. Now, Keith, why did Alexian choose to partner with the Schaumburg Park District?
Well, that's a good question. Really, it was an opportunity that came along, I think, through Gene perhaps talking with Mike Kearns and Matt Wakely, and just seemed like a natural fit for us. Certainly the clinical expertise that we could bring to some of the events that have already had tremendous success with the Tour von Schaumburg, the Run to the Stadium, the Triathlon, Duathlon, just felt like we could complement each other nicely with these events. So we'll have therapists there, we'll have information that can help people better educate themselves about some conditions of the joint and the spine. So it just seemed like a nice avenue for us to go down together.
Well, we're absolutely thrilled to have an organization as professional and as outstanding as Alexian Brothers to work with us and be a partner with the Park District. Dr. Luke, what is your involvement in developing outreach and community programs?
I'm part of a group of individuals from both St. Alexius and Alexian Brothers that really tries to develop programs for the community consisting mainly of golf clinics, skiing clinics, and baseball coaches clinics.
Are you going to be working with us, perhaps with some of our youth or some of our other athletic programs and activities? Will we have an opportunity to, refer them to you?
Yes, we're actually setting up a golf clinic for hopefully early this summer. That's going to be hosted by the Schaumburg Golf Club, and at that's going to be open to the public. And I'll be actually presenting a lecture on golfing injuries, both the prevention and the treatment of golfing injuries.
Do you think a lot of injuries to, like for runners, for example, are due to the fact that they don't really know how to run correctly? They have a bad form?
There's two things. Number one is a lot of it has to do with the equipment that's being used. Running shoes are extremely important. And a lot of patients' foots are suited to certain types of athletic shoes. So that's one thing you look at. Other thing you look at is a lot of runners nowadays, they tend to just increase their mileage at an exponential rate. And they really need to go at it in a more of a training mode. Our role in a lot of these athletic injuries is more the preventive, preventing injuries that occur.
Yeah, I see. Okay.
Do you find that there are more injuries occurring with younger people?
Well, athletics now is becoming very important in the younger patient, less than 10 even. And a lot of these youngsters are not training appropriately. They're not going through weight training, so on and so forth. And unfortunately, a lot of these kids are really pushed to the extreme. And so, yes, there are a lot of adolescent and younger injuries that we see.
Yeah, that's too bad.
Is there a way that or recommendations that you could make that for people to avoid injuries or avoid certain diseases, if you will? I know you see quite a bit of that. Is there some way there's some recommendations you can make about avoiding that?
I think a lot of it has to do with the education of the coaches, the parents, and the athlete. If they have the right training thought process going to both prevent and treat injuries that may occur, I think it'd be very helpful.
Will you be doing clinics like that for athletic organizations? For example, Schaumburg Athletic Association, which is our youth athletic group. They do all the football and baseball and basketball and volleyball, soccer activities. Will you be doing any kind of clinics, or would you do, perhaps I should ask that question, would you do clinics for their coaching staff to help them learn how to work with the youth so that they're mindful of injuries?
Absolutely, and we've talked about doing those types of things, and we're in the infancy of really developing our clinic strategy. But absolutely, I think there are numerous opportunities for us to work with soccer clinics, baseball clinics. I mean, tennis, golf, as Dr. Luke will be doing, but certainly directed at the coaches, as you mentioned. I think there's a great audience there. It's just what's going to be attractive to them and what types of topics will be.
And that education process is so, as you point out, is so important.
When you talk to coaches, do you focus on the warm-up procedures and things, or are there specifics in terms of even the kinds of drills that they can use that are, less injury?
Actually, both. The warm-up process is very important in any type of athletic endeavor. And also the training aspect is also very important. A lot of these kids go through a fair amount of practice sessions, and I think at some point the amount of time involved actually has diminishing returns.
Okay. Yep.
So through the clinic, then, if you or somebody that goes over and wants to go to the institute because they have an injury, then you set up a program for them to follow to help them resolve this problem.
Individualized, sure, that they would. And if there was enough people coming in that we found that there's maybe a segment of the population we should address as a whole, quite honestly, we would do something like that.
Now, you're familiar with the new indoor facility that we're opening, which will have soccer and basketball and volleyball and some gymnastics. So with that having been said, I'm sure that we're going to be working on some clinics together for the coaches and for even the participants of all those activities at that facility.
Absolutely should.
So we certainly appreciate your being here, both of you. This is really outstanding. Dr. Luke, thank you so much for your time.
Thank you.
Mr. Davis, thank you for your time. And we look forward to working with Alexian Brothers. As I said earlier, one of the outstanding medical facilities in the country, and we're very, very proud to have the opportunity to work with them as a partner. Thanks again for being here, gentlemen.
Thank you.